what is autism from the neurological point of view? And why would you be involved? Because you see psychiatrists talking about autism and not too many pediatric neurologists. Can you explain that to me a little bit?
Well, autism is, first of all, I think there's a huge overlap between psychiatry and neurology, and when we're talking about diseases of the brain, there can be, both specialties can deal with it. I think psychiatrists are more used to using a lot of medications that have psychiatric implications, such as patients that have schizophrenia and severe depression. Neurologists tend not to do that. But I think there's an overlap between child psychiatrists and child neurologists in terms of treatment and also research in autism.
But if you were asked to explain simply, what would you define a classical autistic kid to be?
Well, let's define autism, and then let's speak about why, if anyone knows, it may be increasing or not. Autism usually has to have three major criteria. One is you have a language impairment. Two is you have poor interpersonal skills. And three, you tend to do repetitive things. And those are the major three criteria that one has to meet to have autism or pervasive developmental disorder, so-called PDD. I think there are a few key facts to know. One is that you can't, in the year 2006 and 2007, diagnose autism under age 4.5. We do often do it, but we do it for educational purposes. If a child meets those criteria at 2, we say the child for educational purposes or has autism or PDD. Many of those children, though, will change, and by the time they're 4, may not have it. So you really can't be certain until a child is 4.5. All we can say is the child has those criteria at a younger age and may have it.
If you saw a baby 4 months old that wasn't making eye contact and no social smile, does that mean the kid's autistic?
No, in fact, at 4 months you really can't say. You might say that the child may be at higher risk than another baby.
So you would call it a red flag?
You would call that a red flag, a risk factor, but not autism.
Okay, when the kid is 18 months old and not really speaking and not wanting to be hugged and kissed and loved like a kid, does it mean the kid's autistic?
No, it doesn't at 18 months, although the child may have features that are consistent with autism, and that child would be at a higher risk for having it. In fact, we generally, in a child at 18 months, would probably educationally treat that child as if that child did have autism. But we can't really diagnose it until a child is older, in that we sometimes see patients like this that do very well. And so one can't say it really is in the end.
If there was some concern, is there any risk that you know that vaccines play a role in autism?
Well, autism seems to be caused by something that happens intrauterine at large as a major factor for causing autism.
But the routine immunizations that we give kids...
there are probably other risk factors that add on to the expression of the problem. Right now, there is no evidence whatsoever that vaccinations are a risk factor for the development of autism. So there really isn't. It's just that some patients develop autism at 18 months, and that's when people get vaccinations. But other than that, there is no statistical evidence that there is an association.
In Denmark, in 1992, they took the mercury out of all their vaccines, and you figure the autistic rate would have gone down. It was a cause, and it didn't go down. That might be an indicator that maybe the concerns about mercury in vaccines, which virtually have been free from most of the vaccines, weren't really a cause. Is that true?
That's correct. There's really no evidence that mercury is a risk factor for the development of autism.
I believe in 1998 there was a doctor in England who said, based on 1820 patients, MMR must be the cause because it seemed to be increasing when we started giving measles, mumps, and rubella. Is there any truth to that?
No, and when people have looked at it statistically, there's no increased incidence of patients that have had MMR that develop autism versus ones that have not. And in fact, when one doesn't give MMRs, you have higher chance of measles. And if one remembers when we used to have measles, the risk of having a very bad brain involvement with measles, with the development of severe mental retardation, is 1 in 1,000 once you get measles, which is very scary. And people my age used to get measles. So each time we got it, it was 1 in 1,000 chance that we were going to become very impaired. So right now there's absolutely no evidence that vaccinations are a risk factor for autism, and there's great evidence that having these diseases can be very severe. So if one weighs the no clear risk versus the risk of the diseases, it's a no-brainer that one should have their immunizations.
Is there any treatment you could offer a parent at a young age to prevent autism?
Right now there isn't, and our treatments for autism are basically to make certain it's not something underlying genetic, which usually there are not a whole lot of tests to do. We look to make sure the patient doesn't have associated epilepsy, and we give educational intervention. And that really is the main thrust at present.
If we were concerned about developmental delay, and so many of these autistic kids could be development delayed, does the stimulation programs that we have around New York, done correctly, help these kids to some degree?
Well, it's a very interesting question. There's no good data that the stimulation programs really work. However, there is data that when children have so-called developmental delays, if they have good parents, meaning that they intervene and talk to the kid and provide support services, and good schools, those kids do better. That's the only data we have, but there's no specific data that intervention programs per se make a difference in outcome.
They certainly can't hurt a child.
They can't hurt, and we certainly encourage and advise, and all children get to them. And certainly we know that a good environment, good education, good parents, those kids do best.
Thank you, Dr. Pavlakis.